Arthritis is a joint disorder featuring inflammation. A joint is an area of the body where two different bones meet. A joint functions to move the body parts connected by its bones. Arthritis literally means inflammation of one or more joints. There are many types of arthritis, over 100 and growing. The types range from those related to wear and tear of cartilage, such as osteoarthritis, to those associated with inflammation resulting from an overactive immune system, such as rheumatoid arthritis. Together, the many types of arthritis make up the most chronic common illness in the United States. Have you or someone you know been diagnosed with arthritis? Then this is the show for you. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. As mentioned before, today's episode of Healthy Connections will focus on the wide varieties of arthritis. We're fortunate enough to be joined in the studio by Dr. Jeffrey Elston, a rheumatologist from Florida Hospital, Tony Ward, a representative of the Central Chapter of the Florida Chapter of the Arthritis Foundation, and Dr. Renee Modica, a pediatric rheumatologist, one of the few in the state who will discuss juvenile arthritis. And finally, we'll meet Sydney and Deetra Pickens, a mother and daughter, who will share their story. Stay tuned for Healthy Connections. Arthritis. We think we know what it is, but we're going to find out for sure today. Our first guest is Dr. Jeffrey Elston, who is a rheumatologist with Florida Hospital. Dr. Elston, thank you for being with us.
Thank you for having me on.
First of all, let's define the specialty of rheumatology.
Okay, rheumatology is a subspecialty of internal medicine that is dedicated to the treatment of rheumatic diseases, including inflammatory arthritises, autoimmune conditions, systemic lupus, and those type of things.
So with arthritis, you know, as I said earlier, we know what it is. We've known parents, grandparents who've had it, but what is the official or medical definition?
It's damage to the joints. Whenever you get the synovial covering of the cartilage.
Synovial.
Yes, that's the thickening of the cartilage that surrounds the joint. And with arthritis, that lining becomes damaged, and then subsequently the underlying bone can be damaged. And when those occur, then the damage to the function of the joint occurs.
Is there more than one kind of arthritis?
Yeah, it's very interesting. There's actually a couple different kinds. Generally, we kind of divide it up into two types of arthritis. There's the degenerative osteoarthritis, which really occurs with wear and tear over time. Mm-hmm. And then there's the other category of inflammatory arthritises. And that includes things like rheumatoid arthritis and psoriatic arthritis and some of the unusual ones like gouty arthritis and lupus.
How do you know if you have it? How do you know if it's not just the joints being sore or overused and it's a bigger problem that needs medical attention?
Well, there's two differences. Arthralgia is pain in the joints, and arthritis is inflammation and pain in the joints. And so when you have arthritis, you'll generally have hot, red, swollen joints, along with an infusion or fluid collection in the joints. And you'll feel it when you get up in the morning with stiffness or when you try to do range of motion of the joints. And it'll be painful, and you'll notice that it sometimes will get better with a little bit of activity. Okay. But it's generally the joint inflammation and the pain, hot, red, swollen areas that triggers you to be thought of as having a diagnosis of arthritis.
So with darker skin, when you can't see the redness, is the swelling the biggest indication?
One of the bigger ones, yes. Okay.
And so who is more prone to developing arthritis, or does it cut across gender and ethnic lines?
That's a very good question. There's actually two different types. when again you talk about the degenerative osteoarthritis, that really occurs in everybody, and it's a thing that occurs over time. You get kind of a wear and tear to the joint that damages it.
Just the process of aging?
Aging over time, and you usually see it in the weight-bearing joints, such as the spine, the hips, the knees, and that's the kind that grandma usually gets. And then the inflammatory arthritis is the other type. Then it's, by definition, really just about anybody. And you can actually look and see that there is a genetic predisposition in some of the patients that predispose them to the autoimmune inflammatory conditions like rheumatoid arthritis. And then for reasons we're not quite sure, it comes together with an environmental toxin or some type of viral infection, and it triggers the genetic individual, the patient with the individual genetic background, to blossom into an inflammatory arthritis or an autoimmune condition.
So there's really no certain decade of life, if you will, that you see this develop?
No, we actually can see rheumatoid arthritis in pediatric patients and with babies even, neonates, and it can extend into the middle ages or even the teenage years, and certainly can occur as you get older.
So how do you diagnose it?
Well, it's based on 3 factors. You take a good history and physical examination, again looking for the inflammation in the joints. There are pretty good blood tests for some of the arthritis now, including the rheumatoid factor and the anti-CCP test, which has fairly significant specificity for rheumatoid arthritis now. And then radiographic x-rays looking at it also, because the pattern of the arthritis, the radiographic damage, the laboratory testing, and the physical examination all come together to give you a good picture as to the type of arthritis and the severity of it and how you're going to decide to treat it.
So once you get the diagnosis, does that automatically mean it's going to get worse over time, or is there a way to kind of arrest it at a certain point?
Okay. Yeah, we do have great treatments for intervening with the arthritis, but again, it depends on the type. We're a little bit better treating the inflammatory arthritises than we are the degenerative osteoarthritises. We've had some remarkable progress with the osteoarthritises in the form of orthopedic surgery, because as you get to the point where the joint doesn't function as well, joint replacements have done remarkable things for those particular patients. But on the other hand, the inflammatory arthritises, like rheumatoid arthritis, like psoriatic arthritis, we now have significant medications and treatments to try to prevent them from getting to the point of joint replacement.
You said psoriatic arthritis. How is that different?
Well, that's a arthritis that's associated with psoriasis, the skin condition. And there's a subspecialty interest in that called spondyloarthropathies, which are arthritises of the spine that also involve sometimes the peripheral joints, such as the hips and the knees and the shoulders. And it's a similar type of arthritis in that it does have the inflammation and the cartilage and joint damage, but the pattern differs a little bit, and sometimes the treatments.
Is there a lot of confusion between osteoarthritis and osteoporosis, or arthritis and osteoporosis?
That's a great question, and it always comes up in practice. A lot of the patients forget that there are 2 terms. There's osteoporosis, meaning thinning of the bone, and osteoarthritis, which means joint damage or problems with the bone joint. And that's important because they're 2 different conditions and their approach is completely different.
Okay.
Osteoporosis, the thinning of the bone, is when you take medications to make your bone stronger. And then, of course, the arthritis would be to try to treat the joint pain and the joint inflammation.
Are you encouraged by the state of the research at this point?
I am super excited with what's going on with rheumatology right now. We have had such great advances in the treatment of rheumatoid arthritis over the last 5 to 10 years that it really is an exciting time to be a rheumatologist. I can remember when I first started in rheumatology that we felt good at the end of the day if we kept a RA patient out of a wheelchair. And nowadays our goal is to make them healthy people with no problems, and that their main complaint is actually going in to see the doctor for regular checkups.
Well, we like to hear a doctor who treats a disorder who's happy about where the research is going. Dr. Elston, thank you very much for shedding some light and clearing up a few mysteries about arthritis.
Thank you.
We'll be back right after this. Don't go away.